I'm Adam Carrera at Baptist Eye Surgeons. I'm a comprehensive ophthalmologist, and I typically do everything from front to back of the eye, at least to some capacity, dealing with everything from dry eye to retinal detachments. Eye floaters are common occurrences in my patients. They have the vitreous, or the jelly-like substance in the back of the eye. A floater is typically when you have an opacity, a wrinkle, fold, condensation, anything that blocks light coming into the eye, and it casts a shadow on the retina, and that's what patients are seeing. Flashes can mean a lot of different things to patients, and they can be anything from fireworks going off or sparkles to flash bulbs, really extreme flashes, and it can mean various things. Most of my patients, when they're having those, it typically means there's something happening on the retinal surface, whether it be traction or rubbing, some sort of manipulation that's causing the retina to have the patient perceive flashes of light. The retina doesn't have pain receptors, so it just receives light. So when there's traction or tugging or rubbing on the retina, what patient perceives is those light symptoms. Generally, age-related changes within the eye. The jelly or the vitreous within the eye is normally in contact with the retina or on the back surface of the eye. As the patient is aging, that vitreous will collapse on itself and collapse toward the center of the eye and pull away from the retina. When it does that, it can get cells trapped within it, or wrinkles or folds or various opacities that block the light that cause that. As far as the flashes are concerned, they can be associated with the vitreous detachment as well. So when the vitreous is pulling away from the back of the eye, it can rub on the retina or cause tractional component on the retina, and that's what's causing those flashes. So flashes and floaters in most cases are an age-related change that is very common in patients to experience. So the good news is that naturally those improve with time. The flashes will typically go away once the vitreous has fully separated from the retina. The floaters do not go away, but the good news is the brain tends to ignore them over time. So they become only noticeable in certain situations when a patient's looking at either a blank screen or a white wall or blue sky. So there's nothing that you can do to prevent that. As I mentioned, it's a normal part of life. However, you do need to be aware of them when they're coming on. Most patients will experience them at some point in life, flashes and floaters, but just because it's common doesn't mean that it's not without complication. So if you develop any new flashes or floaters, things that can happen as that vitreous is detaching from the back of the eye, it can cause complications. It can cause retinal tears, retinal detachments, can pull in blood vessels to cause bleeding within the eye. So all of those flashes or floaters could be a symptom of something else going on. So anytime that's new, you need to see your eye care provider to get a dilated eye exam and make sure you haven't developed any of those complications.